is Julia Kritzberg. I am one of the students that is in your ethics class, and I'm here to talk about this week's discussion board. So the first point in the discernment that we have to talk about is gather all the relevant factual information. Factual information, 3 points on that I got is that the patient is 41 years old and is 15 weeks pregnant. Her fetus has a condition called anencephaly, and that's where the baby's brain fails to develop. But the mother is mentioned that the mother has no serious health conditions related to the fetus, so there's no serious threat to her. And third point is if the baby is carried to term, it will die within a week, if not sooner, of it being born. The second point was identify the ethical issues. So a couple that I thought were an ethical issue. So there was no issue regarding the truth because the patient was told the truth about their fetus and the condition. The doctor wasn't hiding anything. The second was that the doctor should suggest that pregnancy be terminated, but should give her options. So he suggested his opinion, but I feel that he shouldn't have said his opinion. He should just give her a choice of, you have 2 options. You can continue the pregnancy, or the pregnancy can be terminated. But I feel like the fact that he suggested it, it's kind of, he shouldn't have said what his opinion was. I think he should have just gave her, the options and the facts. And I also thought the nurses shouldn't get involved in the decision making at all. Us as nurses, we should be there to give, support and information. But the fact that they had 2 nurses stating their opinions, it's wrong in my eyes. The third was consider what right relationships require and what leads ultimately to human flourishing. I mentioned that the first point, the doctor should be honest with the patient, which he was, by disclosing the truth. And he suggested his opinion because he thought that's the best thing to do. So the fact that the doctor was honest and was respectful of, disclosing the truth, I found that to be, a good point. Also, the nurses were both honest in their opinions, even though I still think they shouldn't have had a voice and their say in their opinions because they're nurses, but they were being honest about how they're feeling if the patient did ask them what their opinion was. And the third, I think the hospital should get involved and be honest with them about the cost estimates of what would it be to, keep the baby alive for a week. And, I think that's very important as well because money can be a big financial burden on patients. They don't know how much, money it takes to keep, a child alive with that kind of condition. The fourth point was brainstorm possible options. And so the 3 options that I took point to was either terminate or keep the baby. That was 2 options that they had. Also, another option is, does the patient have support from the spouse or from someone, whether she terminates the child or whether she keeps the baby, because having support is a big thing. And third is financial options. Does she have, the money to be able to keep her child alive for a week or if not longer, if that's the case. The 5th is weigh options and select one. So if she does decide to, let's say I picked the option of she decides to terminate the pregnancy, what options does she have? What if she wants to get pregnant again? Like, could this happen again to her? Could she have trouble getting pregnant? And what if, another condition arises? And again, does the spouse agree with her decision? So it's really hard in making, an option, selecting one, because there's always a lot of things to think about. And the last one was evaluate the decision external and internal criteria. So this was a little tough, but, did she make the right decision? Can she live with the right decision that she made? She might regret it down the line. And also, will the decision bring her marriage closer or further apart? If one disagrees, what if her husband agrees to one and she agrees to another, and with her decision making. And then the questions to the case study. The first question was, do you take the side of the nurses who argue the fetus should be given a chance to live as long as possible, even for the remaining months of pregnancy, or the nurses who argue that the pregnancy should be terminated because the baby will die anyway? I don't think it's fair to take sides of the nurses. I don't think it's a nurse's job or decision. I think it's obviously ultimately up to the mother and to the patient. So I wouldn't take sides of the nurses at all. I would take my own side and make my own decision. And the second question to the discussion was, what would you do if you were this woman or her husband? Why? It's a really tough choice. I have a 3-year-old and I'm pregnant now, and it's a really scary situation. Being in her position, she was 15 weeks. If I was 15 weeks pregnant and I found this out, it's hard knowing that the baby wouldn't be, functional or alive, or since it has no brain development. I don't think it's fair to bring a child in this world like that, especially knowing that they don't have that much longer to live. And I think as a mother, you're going to get so attached to that child right away that it's almost not fair to the mother either, knowing that they have to, give up their child and not know how long he or she is going to have. But then again, what happens? What if there's a miracle? What happens if the mother agrees to, bring the child in the world and somehow, the baby's okay? So I think that's a really hard choice. But I know what my husband's choice would be, but I think that knowing how serious this condition is and knowing that the baby doesn't have much long to live, especially it may die within the first week, I think the best thing to do for the child and for the family and for myself, because it's a lot of stress, is probably to terminate the pregnancy, because I don't think it's fair to, put that stress on a family and, on a child, especially if, what happened financially, it's too much on you as well. So those are my opinions and the discussion for this week. Thank you.